Hello everyone. So today we are again here for a very small lecture, yet very important. Yes, I am talking about plantar reflex. Now plantar reflex is such a reflex which is nearly asked in every exam, because no neurological exam is complete without a plantar response, and we know that plantar response is very important whenever it is concerning the pyramidal tracts, because we know pyramidal tracts are the one that will give rise to an abnormal plantar reflex, which is also called as Babinski's reflex. We will see what is that. But remember, I have seen many people struggling with the root values of plantar, with the efferent and afferent pathways of the plantar. So never you should forget what is plantar reflex. For your kind information, I just want to highlight that the root value of plantar reflex is S12. Some book says it is L5 S1, no problem. But to make it very simple, we will just remember that plantar reflex means root value S12. The efferent and afferent both are the same for plantar, and that is tibial nerve. So I have seen people struggling with the afferent and efferent of plantar. They forget to say that, sir, it is the tibial nerve only which is the afferent and efferent for plantar. So plantar reflex is elicited in what way? What are the responses? What are the common causes? What are the other methods? I will try to elaborate them in short, but yet not forget that it is very important in this lecture. So we again have Ayush with us. He is our junior doctor. He will be volunteering again today for you all to understand what is plantar. So Ayush, please lie down. So for plantar reflex, you can use a key, you can use a traumatic object, but we have this hammer. You can use, just unscrew the hammer, use this mildly blunt point of the hammer to elicit the plantar reflex. So if the cameraman can come closer. So plantar reflex is elicited ideally by stroking the lateral part of the heel, starting from the lateral part of the heel and going smoothly till the ball of the big toe. Now if you can show them from the lateral side, when I strike the sole from the lateral part of the heel to the ball of the big toe, all the toes were flexing. This is called as a normal plantar reflex. What is abnormal plantar reflex? For example, if a patient of stroke with involvement of pyramidal tract has came to you, you get something which is called as the Babinski's reflex, which is also called as the abnormal plantar reflex or extensor plantar reflex. So extensor plantar reflex means when you strike the lateral part of the toe of the sole and come to the ball of the big toe, first the great toe will extend, followed by a fanning of all the other toes, and maybe a slight dorsiflexion of the ankle, and sometimes flexion of the knee as well. This is called as a positive Babinski sign or extensor plantar response. This is very common when you will see practically that patients of stroke coming to you. We know that stroke will involve the pyramidal tracts, which are the motor tracts, and with pyramidal tract involvement you have this positive Babinski sign. When you elicit the plantar response, you get dorsiflexion of the great toe, fanning of the other toes, dorsiflexion of the ankle, and sometimes flexion of the knee joint, as well as you can feel the adductors and hamstrings when there is a positive Babinski's response if you elicit it properly. Sometimes we say the plantar response is equivocal. What do you mean by equivocal? Here, sometimes on eliciting the plantar, only the great toe will extend. The rest of the toe will either flex or they will remain as it is. Sometimes there is a brief extension followed by a fast flexion and again an extension. So these are not the classical extensor reflexes that you get. Hence it is also called as equivocal Babinski's sign. Remember, it is not advisable to stroke the medial part of the sole to elicit the plantar. What did I say in the start of the lecture? For eliciting plantar, you will have to strike the lateral aspect of the sole and go till the ball of the big toe, this region. But if you want to elicit what is the density of involvement of the pyramidal fibers, you can strike the medial part of the sole to elicit, because when there is a very dense involvement, that means when many fibers of the corticospinal tracts are involved due to any disease, the reflexogenic area increases. In that case, you can get a positive Babinski when you strike the medial part also. So medial part of the sole can be struck to elicit how dense the lesion is. Otherwise, in minor diseases, you will get the positive Babinskis with this lateral part strike only. So that is very important for you all to know. So many times you can have a absence of corticospinal disease, I mean pyramidal tract lesion, but a positive Babinski's sign. The patient doesn't have a pyramidal tract involvement, but you will have a positive Babinski's sign. What are those conditions? Especially in infants, when the patient is in deep sleep, when the patient is deeply anesthetized, when there is drug overdose like barbiturate poisoning, narcotic poisoning, alcohol poisoning, post-ictal states. These are the conditions where you can have abnormal plantar reflex in spite of an absence of pyramidal lesion. So these things should be remembered. Lastly, whenever the patient is uncooperative and he is not permitting you to strike the lateral part of the sole so that you can say whether the plantar is flexor or extensor, you can just use some other techniques to elicit the Babinski's or the plantar response. These are open Hims test, where you just strike the lower part of the anterior part of the tibia with slight more pressure on the medial aspect, and you go down like this. In that case, if it's a positive Babinski's test, there will be dorsiflexion and fanning of the toes. Other is Shaddock's test, where you just strike the lower end of the lateral malleolus and you strike it, and the patient will show a Babinski's test if at all it is positive. And other is the Gordon's test, where you just squeeze the lower part of the tendoachilles or the lower part of this calf muscle or the gastrocnemius, where the patient will again show a Babinski's test which is positive. So these are the other substitutes for a classical plantar response when the patient is uncooperative. So in short, plantar response, root value S12, some book says it is L5 S12. Efferent tibial, afferent tibial, very important. Plantar has the same nerve as efferent and afferent, and that is tibial nerve. Normal plantar is flexion of the great toe and the other toe. Abnormal plantar or Babinski's is extension or dorsiflexion or extension of the great toe and fanning of the other toes with slight dorsiflexion of the ankle joint, and sometimes withdrawal and flexion of the knee as well, so that the patient pulls the foot back. So this is very common with pyramidal lesions, corticospinal tract lesions. So this was in short yet in very much detail about the plantar reflex. So I hope now you will not commit too much of mistake with the plantar reflex in the exams, and you will also apply these knowledge in daily day-to-day management of practical patients. Thank you so much for your patient watching.